Have you ever wondered what it's really like inside the high-stakes, pressure cooker world of a medical exam? We're about to dive right in, and let me tell you, it's a place where thinking fast and communicating clearly makes all the difference.
So, let me ask you something. What do you think you could realistically diagnose in just 4 minutes? That sounds kind of impossible, right? Well, for medical students, this isn't a hypothetical question. It's a skill they absolutely have to master.
So how on earth do they manage to do it? Well, first, you gotta understand the sheer challenge they're up against. We're talking about a world that is all about pressure, precision, and performance.
Okay, so picture this. You're a medical student. You're in what's called a clinical viva, which is basically a high-stress oral exam. You've got an expert watching your every move, a patient waiting for answers, and you can practically hear the clock ticking. Your job? Get the patient's story, get it fast, and get it right.
And how much time do they get for all this? 4 minutes. That's it. Just 240 seconds to build a connection, figure out the right questions to ask, actually listen to the answers, and start piecing together a complex medical puzzle. I mean, the pressure is just off the charts. So how in the world do you train for a moment like that? This is where a really brilliant technique comes into play, one highlighted by Dr. Martaza Ihsan Ansari, an associate professor of ENT. It's called scenario-based history taking. The idea is actually pretty simple, but it's incredibly powerful. You use simulated patient cases to practice these exact skills in a safe, controlled, and, timed environment.
Okay, so that's the theory. Let's see what it looks like in practice with a real simulated case.
All right, here's the setup. The student is presented with a 42-year-old woman. Her main complaint is dysphagia, which is just the medical term for having difficulty swallowing. This has been going on for 10 long months. And to make things more complicated, she's also been losing weight. The diagnostic puzzle is officially on the table.
Now, what's so effective about this whole setup is that it's not just a one-on-one thing. You've actually got 3 key people in the room. You have the trainee, of course, the one practicing their skills. You have the simulated patient who makes the whole thing feel real. And then, and this is so important, you have the expert observer. They're the safety net, the guide, the one providing feedback. And all of this brings us right to the heart of it all, the 4-minute practice. The goal here isn't just to survive the clock, It's about actually achieving mastery because you're being observed and guided.
So how does it work exactly? Well, first, the student just starts talking to the patient, getting the conversation going. As they're doing that, the instructor is watching their technique, taking it all in. The whole thing is happening under that intense 4-minute time limit. But, and this is the crucial part, it all takes place in a supportive space. The goal is developing the skill, not just passing a test. And that really gets to the core philosophy here. This isn't some gotcha test designed to catch students making a mistake. It's an interactive, guided practice. It's all about building those bedrock clinical skills: communication, empathy, critical thinking, the stuff they're going to need for their entire careers. So you might be thinking, it's just a 4-minute drill. What's the big deal? Well, let's talk about why this matters so much, way beyond the confines of any exam room.
The benefits are just massive. This kind of focused practice leads to better diagnostic accuracy and way more effective patient communication. It sharpens their hands-on examination techniques and builds the confidence they need for real-life, high-pressure situations. And in complex fields like ENT, where one subtle symptom can be the key to everything, this foundation is absolutely critical.
Because at the end of the day, this isn't really about passing an exam. It's about preparing students for real-world patient care. It's about getting them ready for an environment where clear communication and sharp diagnostic skills aren't just academic buzzwords. They are the tools that actually save lives.
So to wrap this all up, I'll leave you with a little something to think about. The next time you're at the doctor's office, just pay attention to their communication. How do they ask questions? How well do they really listen? Because what you're observing is a skill that wasn't just learned from a textbook. It was forged and perfected in high-pressure practice sessions, maybe even ones that lasted just 4 minutes.